We're in the home stretch. We're going to session 3 now. We have 3 speakers, and then we'll adjourn for the afternoon. So we're going to kick off this session with a slightly different type of session. I'm very fortunate to have Alicia Weiser here with us.
Hello.
Who has graciously agreed to share her story and journey and reflections on living with chronic pancreatitis. And if I do this right, you will hear very little from me, and this will be mostly Alicia's time to shine. Oh, sorry. Great. Can you hand me the So, you know, I think we had a very stimulating session this morning, hearing a lot of different supposedly 101 primer-like talks, and only to realize there's a lot we don't know and a lot of interesting questions. And I think as physicians, at the end of the day, what we do as providers is we are with patients. And while we can learn from our research and learn from our dialogue at scientific meetings, perhaps the people we really most need to be listening to that should drive our mission and our focus should be our patients. And so these are just some quotes in that spirit. And we listen to your patient who is telling, or she is telling you the diagnosis. And there's only one cardinal rule: one must always listen to the patient. So this is really going to be kind of a dedicated opportunity where we can reflect on a patient journey. So, does that work? Great. So I'd like to introduce Alicia. Maybe Alicia, do you want to go ahead and tell us a little bit about yourself, where you're from?
Yeah, so I'm 37. I'm from Knoxville, Tennessee, born, raised, still live there. I have 2 children. One of them has pancreatitis and the other one doesn't. So we have genetic form of pancreatitis. My mom, who's sitting over there, has it. She gave me that wonderful gene. And then my grandmother has it. My niece has it. So it runs really deep in our family. I think that the biggest issue was I was very, very young when I was diagnosed. I was diagnosed at 3, that it took a lot of physicians. They didn't know with my mom what it was. They didn't know with my grandmother what it was, so they called them crazy. And I can't remember the medication that they gave you, but I know that it was, what?
Phenobarbital.
Yeah, because she was crazy, right? She didn't know what she was talking about.
But you were 3.
Yeah, I was 3.
What symptoms were you having?
So my parents brought me in because I would have episodes where I was nauseous and vomiting, and I couldn't hold any food down, and you know, it'd get to the point where I was going to be dehydrated, so they'd have to put me in the hospital and put me on an IV with pain medication and, you know, just whatever else. I'm not a doctor, so sorry.
Mm-hmm.
And take me off food. And then from there, they would reintroduce food slowly, but it would take a few days for things to kind of get back to normal. And then, who knows, a few months later, I'd have another episode. So I eventually had my first surgery when I was 5.
Yeah, so this went on for a couple of years.
Yes.
I think I remember we were talking about what do you remember as a child in that regard.
Everything.
Yeah, you were talking about how you remembered like
the smell of things. I mean,
yeah.
Back in the day, they didn't put you to sleep before you went off to surgery. So I went in fully awake. You know, they were putting all little heart things on. Yeah. And I'm like looking at all these doctors because it was an anomaly, I guess, at the University of Tennessee where I had my surgery for this to happen on a child. This was in 1980. I don't do math either.
In the 80s.
In the 80s. So it was a big deal. And there were many doctors that were in the room. And I remember them like not giving me anything to chill me out before. And then holding my breath actually when they put the stuff on to like put you to sleep, and then realized, oh no, they may operate on me and I'd be awake. So then I just like started hyperventilating basically, and then I guess I passed out, but woke up in immense pain. And it was very hard for the doctors to control it. But from that surgery, I had a lot of relief. I think they put a stent in as far as we know.
Yeah. So you had this operation at age 5, and then it sounds like from 5 until college, you were actually okay?
Yeah, I was thriving. I cheered, I swam. I wasn't that great in school, but that has nothing to do with pancreatitis. That's maybe. I'm just kidding. But yeah, I was very social and had a great life until about 18.
What happened?
I don't know. I can't tell you. All I know is that I started having episodes again. It was frustrating. I was trying to go through college and trying to live a normal life, but I couldn't. The pain was horrible. And again, there were not very many options as far as gastroenterologists. So my mom and I looked around and we found one. And I did some celiac plexus blocks during that time, but they did not really work.
What were you getting for pain?
Pain medication, like which type? It just depended. Like if I was in the hospital, we tried morphine at first, and then I'd have a weird reaction with that. And then it was like Dilaudid, and I was like pulling my eyebrows out in the sink because they had me on a drip for it. And it was just a little too much. And then I can't remember any of the other. Oxycontin had just come out on the market, so I got to be one of the first patients to use that.
And I remember when we were talking a little bit about this, it was also a very frustrating time because you felt the doctors were trying to help you by giving you the pain medications, but it also didn't seem to be helping, and you had some frustrations trying to communicate that. Yeah,
I mean, I think a patient like me is really complicated, and doctors like to fix things. And when they can't, they want to put people in a little box and say, okay, we're just going to give her pain medicine and not listen to her. Nobody was talking to each other. My doctors weren't talking to other doctors. Nobody was communicating. So I'm in this great hospital, yes, but these doctors aren't willing to reach out and talk to other people in other professions, I don't care, around the world, reach out for your patient. So it became really depressing. And I was basically told, you're just going to be living on pain medicine. And that's when my mom and I decided, like, we have to do something else. I could not live like that. It was just, that's not okay. That's not who I am. So we went to the Mayo Clinic.
And this was how long from, this started around 18. How long was this, what you were just describing, going on for?
I think I ended up having my surgery when I was like 23.
So you went to the Mayo Clinic and had another operation?
Yes. It was very invasive, but again, pretty successful.
Do you remember the operation?
The fry procedure.
Okay.
Yeah, and again, I seemed to be able to live life really well after that.
So it helped?
Yeah, it definitely helped. It helped better than anything else that we had tried. And it was nice to know that there was other options other than pain medicine, because it helps, but it just numbs what's going on. I mean, it doesn't cure it. It doesn't fix it. So you can get stuck in a loophole.
How old were you when you had the operation?
I think I was 23. Yeah.
23. So then what happened?
Well, after I went for surgery, I went back home and recovered for a little bit. It took a long time to recover from the surgery for me. And I ended up going to rehab to get clean from the medicine, which was a whole other trauma, because it's a different, yes, I was addicted, but it wasn't like something that I chose. So being looked at in rehab for having this issue was pretty crazy. But yeah, from there, I got really better. I got a whole lot better. I was able to live my life again, and I met my ex-husband, and that's when I got pregnant with my first child.
How old were you?
I was about 24, 25.
So a couple of years after your operation.
Yeah, a couple years after. And the pregnancy went pretty good up until the end. She started getting bigger and she was pushing on my pancreas, and that was causing it to have pain again. So they did like a C-section, and then she was delivered, and she's healthy, and she's really happy now. She's 12.
What's her name?
Allie.
Allie.
Yeah.
So it sounds like in the third trimester, you were having some pain that was reminiscent of your pancreatitis.
Yes.
And it went away after the delivery of Allie.
Yes, it did. And then I got pregnant with Henley.
Yeah. And
Henley has pancreatitis.
Yeah.
And it's kind of weird now that I look back on it. I think she was tested. They do a test when you're pregnant for cystic fibrosis.
Mm-hmm.
And it showed that she had that, or I guess it's the same gene.
Mm-hmm.
But I was like, no, I think it's probably pancreatitis. They were like, no. I was like, okay, you're right.
So after delivering Henley, then what happened?
Well, I had pain, and they had ended up doing a scheduled C-section with her.
Yeah.
And so that helped a little bit. But my pain would not go away. And so immediately the doctors thought, oh, it's your pancreas, it's your pancreatitis, you're having a flare, this is happening. And I was like, I don't know. It's radiating to my back, but it's like, it doesn't feel exactly the same. It's kind of happening different. And my doctor, after months, decided to check for my gallbladder.
You had a HIDA scan, right?
Yes. And it was not functioning.
Mm-hmm.
So they went in immediately and took it out. And I was free of my gallbladder and the pain, and I could be a normal mom.
So you end up getting a gallbladder removal about a year after Henley.
Mm-hmm.
And since then, how have you been doing?
I've been doing pretty good. I mean,
that was about 10 years ago then, right?
Yeah, I'm probably not the ideal patient. I do not see my doctor. Sorry. But I kind of feel like if it's not broken, don't fix it and don't judge me. But I've been through a lot. And I don't know. I mean, I go around, take care of my kids. My youngest.
And you haven't been hospitalized or hadn't had any ER visits in the last decade?
No.
Right.
Yeah, it's kind of remarkable. I feel like I need a board or something around here.
Here's my head. Any GI symptoms?
The only thing that I struggle with now is just digestive issues. Maybe having like fatty stools and diarrhea, and it does come in bouts. And I really try to eat about the same thing and keep kind of like on the same diet, but it doesn't matter. Sometimes it could be stress, I guess, that triggers it, or I'm really not that sure.
Okay. So let's talk about Henley then. So when did you find out that Henley had pancreatitis?
When she was 2. She started showing symptoms. She was stretching her belly and hurting, and it got to the point where one time she was throwing up and vomiting and everything, so we had to take her to the hospital, and then they confirmed that she did have pancreatitis. So she stayed hospitalized for about a week. The therapies, though, that were offered this time around were a little bit different than what I had, which was just pain medication. Now they brought in like the little dog for the kids. I don't know. It's just
therapy dog.
Yeah. They had somebody come in and do Reiki. I don't care. Like, just make her better.
Yeah.
They did have pain medicine for her as well. So they kept, pretty close eye on her and her pain levels. I can't remember. Oh yeah, and aromatherapy. They brought in like essential oils, and so it's interesting to see the mesh of maybe some Western and Eastern medicine coming together finally for the benefit of children. And I would encourage that doctors really try to look into some different therapies other than just pain medicine. it's just masking the issue.
And how is she holding up, and how have you been holding up in that regard? We talked about your own health, but how has it been to watch her process this, similar to what you went through?
Now that this is like a third, fourth generation kind of thing, you know, I get to watch my future through my mom. I look at my past through my daughter, and then I have me now. So I've just tried to help guide her to really pay attention to her body, to pay attention to what she's eating, and if it's something that's bothering her, you know, veer away from it. If you feel like you're starting to hurt, maybe back off of the food and we'll go on a brat diet. Try to do everything to keep her out of the hospital, for her to pay attention to her body, and also just to really have some good communication.
So, and thank you so much for sharing your story with everybody. Again, I can't thank you enough for being so courageous and brave and open about you and your family. We, you know, in preparing for this, we also thought about some themes about, you know, as you reflect on what you've been living through, some things that we talked about that we perhaps wanted to touch base with, you know, share with the group. And one of the themes was about this whole issue of navigating chronic pain management. And I think we started to touch on that. You had kind of mentioned how it was very frustrating for you to feel heard by your doctors. Could you maybe expand upon that?
Yeah, I mean, pain medicine is complicated. I think that it's a necessary evil, unfortunately, especially with pancreatitis, because it is extremely painful. But again, all it did was kind of mask over the issue. It did allow me to try to finish college, to try to like be normal. But ultimately, and I didn't find this out until after my last surgery that I had, Toradol really helped. And I don't know like how long you can actually take that, but I thought that it was very beneficial. And in fact, when my daughter was hospitalized this last time, they incorporated that into her pediatric care while she was hospitalized. And she seemed to do really good with it. Now, I don't think it's something that you can give on a regular basis, unfortunately. But
and I think you started talking about this. You know, the other thing we want to talk about is rules of the road. You've been through this. You've seen your mother and your grandmother do this. You've kind of come up with your own set of how do you manage this. And now you have a daughter who unfortunately has this, and you're trying to be her mother. What kind of conversations have you had with her? What kind of lessons or that you would want to impart upon her about how to live?
Mainly to listen to her body, to pay attention to it, take care of it. I hope that she eats healthy. She really hasn't been, she's been hospitalized twice. One of the things that I noticed of both of the hospitalizations is that, and I've tried to keep a journal for her too, so I could see if there's any patterns. It was antibiotics. She got an ear infection, and we had oral antibiotics and the ear drops. Well, the oral antibiotics were sending her into a pancreatic attack. So both times. Now, I don't know if it's just a coincidence or not, but it was just regular old pink amoxicillin, bubblegum pink. So yeah, we kind of veered away from that. And, you know, the doctors are very aware that she does have this condition, so they're pretty chill about not just giving out antibiotics.
Okay. Well, thank you. Would you mind if we open it up for any questions? Anyone in the audience have any comments or questions that you'd like to add to Alicia's Gretchen? Yeah, please.
Thanks for sharing, Alicia. That was really great. What do you want us to know as healthcare providers? What is it that we can do to help persons like you and your families?
I think the biggest thing is to listen to your patients, and don't put us in a box. Don't try to say, oh, this is what I've seen, this is how it goes. Really make it more interpersonal. Do the genetic testing if you can. Sorry.
Sure.
Do genetic testing if you can, but mostly everybody should be talking. Everybody in the gastro community should be talking about it together. And so let your egos go and really put the research together. Work together. All physicians.
Thank you. Any other comments or questions? Mel?
Thank you for coming today. One thing I spend a lot of time with patients. I assume you know the specific genetic abnormality it is, and maybe you haven't gotten tested. But some of the patients that are more idiopathic chronic pancreatitis, with stories like you, I always try to enjoy it. It's kind of painful, but sometimes we can help them through it. It's this whole ER thing. It's like you're a druggie, right? How many times have you been told that? Or you had a glass of wine maybe 2 decades ago, and they automatically labeled you as an alcoholic in the ER. It's really a phenomenal thing. And so some of the patients, I try to get the genetic testing so that when they do go to the ER, they say, hey, this is what I have, and maybe they would take you out of the box and listen to you a little bit more. So I think sometimes, at least for me, I try to get a diagnosis. Yeah, you might not be able to do it genetically when you go into the ER. No, you're not just another drug seeker. You're not an alcoholic. You really have a diagnosis, and maybe they'll take you out of the box.
I totally agree. In fact, when I was 2 or 3, I think my mom told you the story, they asked her if, I was drinking. I'm like, yeah, I'm hitting the bottle real hard. Literally.
That would be the pacifier real hard.
Yeah. Yeah. So that's crazy. But yeah, you see people that are, pill heads and addicts, and you can't lump this patient into that, even though it's really easy to lose the empathy, and to just push people aside. And the ER is the worst, because you go in and you know that that's your first stop. You have to go to the ER in order to get admitted. And half the time, there's no communication from the gastroenterologist to the ER doctor. And I'm struggling in the ER the entire time until I can get on the floor with my doctor. Those were miserable times. I mean, it took sometimes hours for anyone to even start an IV. The medicines that they gave back then are a lot different now. But the nausea medicine and everything, it was just, I'm pretty sure if my mom was up here, she could probably reminisce a little bit more on my childhood experience. I think I've blocked some of that out. But yeah, even as a teenager and walking in, immediately they're thinking, oh, well, she's just pill seeking. As an adult, same thing. So trying, and knowing that you have been to rehab afterwards, it's a scary thing. I don't want to be around pain medicine. It's really hard for me to go around doctors, to be honest. I just feel like I've been poked and prodded at so much throughout my life that I just don't want anyone to touch me. And I know that that's not the right thing either. But that's
how
what
you
it's
feel.
led me. Yeah.
Well, thank you so very much, Alicia, for
Thank
taking
you.
time to be here. Thank you.